Hi everyone, Whitney Lowe here, and today on our Clinical Insights video, I'd like to talk about one of my favorite topics in the rehabilitation world, and that is assessment. This really is something that became evident to me early on in my practice that if I was going to work with people having pain and injury conditions, it was really important that I have a good idea what was really wrong. And I realized a lot of what was being taught in many of the educational programs was all about techniques we can do with people, all kinds of different methods to do different massage strokes with them or different types of techniques, but not much information about how to really know what was wrong with somebody. And I realized that that's really a problem. If you don't have a good understanding of the nature of the problem, you might end up doing something that's actually harmful for somebody, or in the very least, it won't be as effective. So the idea behind assessment is it's crucial to have a good idea of what's going on, and that's going to make you the most successful practitioner. Now, for years, I've looked for ways to kind of shortcut this process and try to find some way to sort of consolidate all the challenging information that you get from the assessment process, because you're going to take a detailed, comprehensive history with somebody. You're going to look at various different things with their physical appearance, posture, swelling, all kinds of factors that might be present there. Now, when it comes to the physical examination part of assessment, this is one of the areas where you can get so much information about the nature of your client's problem, but it's really amazing to me how many people don't go into this in detail. So what I want to do today is I want to introduce to you some concepts to make that process easier and to sort of shortcut the way that you can gather information and find out how to make that information helpful in your assessment process. So I created this assessment cheat sheet to try to help you kind of get a better idea of how to get that information most effectively and most efficiently, and then how to interpret that information. So if you want to, go ahead and pull up a copy of this assessment cheat sheet. You can grab it off our website at academyofclinicalmassage.com/cheat sheet. academyofclinicalmassage.com/cheat sheet. So once you pull that up, you'll have a look and see what we're going through here. Now, we're going to be focusing on three aspects of the physical examination in this cheat sheet: active range of motion, passive range of motion, and manual resistive tests. And one of the things that I've found over the years is while a lot of people were taught basically how to perform these procedures, the thing they weren't really taught very well is how to interpret the information that comes from performing those procedures. And that's what we're going to focus on in this cheat sheet. So let's go take a look at it. Okay, so I mentioned we were going to focus on three different types of evaluation procedures: active motion, passive motion, and the manual resistive test. What you'll see across the top of this cheat sheet is 5 different categories. We have active shortening and active lengthening. These are going to be the two things that we're going to focus on that'll happen during active range of motion tests. We have passive shortening and passive lengthening, because remember, during motion, some tissues might shorten, some might lengthen. So we have passive shortening and passive lengthening here. And then during a manual resistive test, there is no change in motion at a joint. So we're just having one category here with the manual resistive test to see what happens to these different tissues. Now, keep in mind, all of these are really focusing on the mechanical forces that are impacting tissues. There's other factors that might play a role in whether or not somebody has a pain condition, all kinds of things having to do with the nervous system, with the way pain is processed in the body. These factors are not necessarily going to be highlighted in this particular process when using the assessment cheat sheet. This is focusing mostly on some of the biomechanical factors that might be present, causing certain types of pain complaints. Now, the way the sheet is set up, we have these different types of motions or evaluation procedures across the top. And then down here on each page or category here, we're going to look at one type of tissue. Like, for example, on this page, we're looking at muscle. And then we're going to look at the most common types of injuries to muscles, whether that's a strain, where a muscle is pulled excessively and there might be torn muscle fibers, or whether that's just hypertonicity and myofascial trigger points, which is really more of a neurological or neuromuscular phenomenon. Or another type of injury would be a contusion, where a muscle is subjected to a very high impact force trauma. So these are the things that might potentially happen and the results of the evaluation procedure if this particular type of condition is present. So for example, in a muscle strain, if we look at what happens if that muscle is actively shortened during a muscle strain. Let's say, for example, you have a strain in the biceps brachii muscle. What's going to happen during active contraction where that muscle is shortening? So there is likely to be pain in that particular muscle, especially if there's a significant load on it, because you're really recruiting a lot of those damaged muscle fibers. The same thing might happen when you actively lengthen that muscle during an eccentric contraction or even a stretched movement where that muscle is getting increasing in its length. Now, during passive shortening, what we'll see, that rarely produces pain in a muscle strain because you're taking a load off of that muscle and decreasing the forces that it's subjected to. But during passive lengthening, that muscle can get stretched and pulled, and if there's a strain in there, that's likely to increase those irritations, sensations, and increase the pain that a person is feeling. In the manual resistive test, again, very similar, likely to reproduce pain if there's a strain in the muscle. And frequently, the worse the strain is, the greater the level of pain is up to a certain point. So that's basically what we're doing on this assessment cheat sheet. We're taking a particular type of tissue. We're looking at the most common types of conditions or injuries that occur to that, and then looking at what happens in these 5 different types of scenarios that are going on here. Now we'll go through muscle tissue. We'll go down into tendon tissue, nerves, looking at what happens as all these tissues have various different mechanical forces subjected to them, joint capsule tissue. And then there's a couple of them that are very short and close to the joint, so they don't really have the opportunity to stretch and elongate very significantly, but there are forces that might impact these. So we're going to look at, for example, ligament and bursa, and also cartilage as these different tissues that are very close to the joint and are impacted by different types of forces, but not to the same degree as those other longer tissues that span much greater distances, and therefore, consequently, they're subjected to greater mechanical forces over those distances. So what you can do is take this assessment cheat sheet, and as you go through the various different range of motion procedures, you want to look at what's happening in these different tissues, and that's going to point you in the direction of what a likely scenario might be. So when you perform your evaluation procedures, you might say, you know, a person has pain in this region when I actively lengthen those tissues and maybe when I passively lengthen them, but no pain when I was passively shortening them. Then you want to look at, does that information go in conjunction with what you found out in the history? Because this physical examination doesn't exist in isolation. You do this in conjunction with what you're doing in your other parts of your evaluation. So remember, the physical examination is part of a comprehensive assessment process. This is just used as a way to help you consolidate and streamline the way that you take in information there. So here's a quick overview of our assessment cheat sheet. Again, grab that off our website at academyofclinicalmassage.com/cheat sheet. It's going to be a great way. Just keep that handy in your treatment room. It's a great way to just pick it up, take a look at things. And what you'll find is the more you spend time working through these processes, the information on that cheat sheet becomes kind of second nature, and you really get an idea of understanding and being able to pick up what the nature of these different problems are simply by having a good understanding of what happens to those different tissues under different circumstances when certain conditions are present. So again, thanks for taking a look at that, and I hope that helps you in the treatment room.